Executive dysfunction in ADHD. Attention deficit hyperactivity disorder has been associated with a prominent disturbance of executive functions. There is no pathognomic neuropsychological profile for the disorder. However, nonetheless, results of neuropsychological testing in concert with other clinical information provide a more comprehensive and detailed picture of the individual patient's cognitive and emotional strengths and weaknesses than a psychiatric diagnostic interview alone. This approach to the evaluation of ADHD therefore can provide a strong objective basis from which to make patient-specific recommendations for compensatory strategies and treatment. It should be noted, however, that although executive dysfunction in the form of impaired response inhibition remains the most prominent cognitive theory of ADHD, other theories have been put forth that also deserve further investigation. These include a disturbance in delay aversion, referring to intolerance for waiting, and impaired temporal processing, among others. The neural substrates of executive dysfunction in ADHD have begun to be revealed by a growing body of structural and functional neuroimaging research, and the cerebellum as being central to the cognitive and motor abnormalities seen in the disorder. It is expected that advances in structural and functional neuroimaging will yield valuable information that will facilitate the differential diagnosis of ADHD. Additional studies investigating the effects of treatment on executive dysfunction and brain integrity in ADHD will be necessary to determine the degree to which the structural and functional brain abnormalities observed are mutable. Finally, because the myriad cognitive, behavioral, and emotional symptoms in ADHD likely reflect the interplay of multiple cognitive and psychosocial factors, development of treatments for ADHD likely will require a multimodal approach. Depression may affect certain executive functions such as memory, attention, and control of inhibitions. Alzheimer's can sometimes severely impair executive function, and a person may no longer be able to drive, get dressed, or behave appropriately in social situations. Symptoms. People with executive function issues may have the following symptoms: trouble controlling emotions or impulses, problems with starting, organizing, planning, or completing tasks, trouble listening or paying attention, short-term memory issues, inability to multitask or balance tasks, socially inappropriate behavior, inability to learn from past consequences, difficulty solving problems, difficulty learning or processing new information. Executive function takes time to develop, so many of these behaviors are completely normal in young children. However, if these behaviors persist, they may indicate that the child has executive function issues.